Are worn-out joints keeping you sidelined from the activities you love? Check out how a doctor got his game back and why colleagues and teammates now joke that he's practically bionic. He jumps, he hops, he stretches and climbs, and that's just in his spare time. When he's on the clock,
Hi, Mr. Bendare.
anesthesiologist Dr. Calvin Johnson works hard to calm patient fears. He's been in their shoes.
I explained to them that I've had anesthesia, that I've had surgeries.
More times than he can count, most of Dr. Johnson's major joints have been repaired, rebuilt, or replaced.
We're doing so much stuff that our joints wear out.
Orthopedic surgeon Dr. Sanu Aluwalia says knee and hip replacement surgeries in his practice have tripled since 2004.
Now, people want choices.
And they're like, I'm not sitting around, I'm not hobbling around.
At age 46, I still wanted to play basketball.
Dr. Johnson has been a fitness fanatic all his life. He was a college basketball star and a one-time NBA hopeful. He gave up his hoop dreams to become a doctor, but he never cut back the intensity of his drills. By the time he was 40, his hips started hurting.
As it progressed, the pain got more and more severe.
Eventually, the pain was there 24/7, a threat not only to his workouts, but also his job.
You can't deliver health care if you're in pain. That's a big distraction.
Dr. Johnson's agony caused by arthritis in his hips. Here's what an arthritic hip looks like in an X-ray.
All the cartilage is gone.
Arthritis hip pain isn't located where most people expect.
It's actually in the groin. That's where we feel it.
At 46, with his job and his lifestyle on the line, Dr. Johnson had a tough decision to make, whether or not to undergo a double hip replacement.
It's surgery and anesthesia, and it's nerve-wracking. I have to admit, I was afraid.
Hip replacement involves taking out the arthritic joint and replacing it with a man-made one.
There's the ball that we've put in. This is the stem that holds it in place.
Dr. Johnson had both hips replaced in 2006.
When I woke up, the amazing thing is that the pain is gone.
He was back to work 9 days after surgery, back to his workouts 4 months after his second hip was replaced. It's been 5 years since the replacement. Dr. Johnson still carries his X-rays on his phone. He's not afraid to brag to his opponents.
That's what I played on today. 2 artificial hips.
Dr. Aluwalia wishes Dr. Johnson would take it a little easier. He warns joint replacement surgery should never be taken lightly.
We can never replicate what used to be, but I think that you should have a pretty good ability to do all the things you did before.
He doesn't know how to take it easy. The average lifespan of an artificial hip is 15 to 20 years. The more stress you place on it, the quicker it might be needing replacement again. To keep your natural joints healthy as long as possible, Dr. Aluwalia advises keep your weight under control, stay fit, but avoid high-impact exercise. We have more on our website, myfoxla.com.